How many people will die before this pandemic is over? Every day the numbers go up. We wait hoping the measures we take will flatten the curve. But while the statistics in some places begin to settle, on others they start taking off exponentially. And those numbers and dots, they are people dying by the thousands daily. So how bad could all of this actually get? The predicted death toll for the coronavirus pandemic is the subject of much speculation. A matter that only becomes more confusing as statements of global leaders often try to avoid panic amid possible death and economic woes and different scientific studies coming to very different scientific conclusions. Let's start off with the leaders. First off, we have Donald Trump and Boris Johnson as examples of leaders who did not react with haste and efficiency to the pandemic and tried to downplay the severity of the crisis. Here are some of Trump's best downplayed moments.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat. Because of all we've done, the risk to the American people remains very low. It's going to disappear. One day, it's like a miracle, it will disappear.
Unfortunately for the people of the United States, we're getting to mid-April and the land of the free and home of the brave is the worst affected country in the world. And so Donald Trump has had to backtrack from these initial statements, declaring on March 30th that 2.2 million deaths. And so if we could hold that down, as we're saying, to 100,000, it's a horrible number, maybe even less, but to 100,000. So we have between 100 and 200,000, and we all together have done a very good job. Trump is not the only prominent leader who was and still is possibly confused. In the UK, Boris Johnson's administration initially tried to adopt herd immunity.
60% is the sort of figure you need to get herd immunity.
And then PM Boris tried to reassure Britons by professing this.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody, you'll be pleased to know, and I continue to shake hands.
Until he eventually contracted the virus himself. Today, the UK is on a steep curve, treading on the path of becoming Europe's hardest hit country. But mitigating measures such as isolation, social distancing, and eventual lockdowns were prompted by science. Specifically, a study made by Imperial College that set global alarm bells off. We estimate that in the absence of interventions, Covid-19 would have resulted in 7.7 billion infections and 40 million deaths globally this year. This is what experts at Imperial College had to say. Another SEIR model, published by the New York Times, specific to the US model, predicted that with no measures, more than 1.3 million people would die under these conditions and 125 million people would recover. The Economist's intelligence unit also predicted that the virus will infect 50% of the world's population. 20% of those will be severe cases, and 1 to 3% will result in deaths. If we assume the world population is 7.8 billion, then that means that more than 3.9 billion people will be infected, of which 780 million cases will be severe, and deaths could be anywhere between 39 and 117 million. But there is light at the end of the tunnel, because the Imperial College report suggested that ultimately 95% of deaths could be avoided. That's 38 million people. But it still leaves us with 2 million deaths in an almost best-case scenario, with the right use of suppressive measures that include shielding the elderly and slowing the transmission using increased testing and isolation of cases and wider social distancing measures. But as healthcare systems from New York to London are overwhelmed and under-equipped, the question of what the rest of the world will do and how it will impact the overall death toll gains relevance. A few days ago, billionaire and Microsoft founder Bill Gates sent a message of optimism to his fellow Americans by stating that if social distancing measures are practiced properly, that the US will fall well short of President Trump's estimated 240,000 deaths. But Bill Gates, who has been trying to warn the world of a pandemic for years now, has drawn attention to the real nightmare scenario of the coronavirus spreading in the developing world. Talking to the Financial Times and TED Talks Daily, Bill Gates had some chilling warnings. He said, quote, "Sadly, we could see in the next few months as the southern hemisphere is moving into its fall and then winter, we could see a big increase there." Calling the developing world the wild card in this pandemic, Bill Gates stated that despite the young population of the continent that has a median age of 21, that malnutrition, unequipped healthcare systems, and pre-existing lung conditions and other diseases such as HIV make the continent extremely vulnerable. He also explained the different contexts that developing countries work within. For instance, the lockdown-style measures we have seen in the developed world are harder to implement in countries where people have a small basic income and the government would need to account for nutrition needs, as families struggle to survive at home, pointing out that people who live in the urban slum areas will likely be the most vulnerable within the developing world. But the billionaire has called on countries of the developed world to provide much-needed economic and medical assistance to prevent a nightmare scenario. All in all, it's a difficult, if not impossible task to predict the final death toll. From the numbers we have currently, it seems you can end up having a few million deaths because of coronavirus, or perhaps tens of millions of deaths. And so, as most of us are at home struggling to get our heads around this global crisis, let's take preventative and mitigating measures seriously and work for the best possible outcome for humanity.